patients have noticed in the exam rooms why we have this poster called the candy poster. And it's asking, why is candy good for your children's vision? And that poster has to do with an actual study called Controlling Astigmatism and Nearsightedness in Developing Youth. And it's really about GVSS or ortho-K, which is a way to control nearsightedness or myopia. And they actually did a study because we want to know, like, how does this work? You know, you see your child and every year they get bigger and every year their shoe size gets larger. Well, people that are nearsighted as children, every year their nearsightedness gets worse and worse and worse. And so what we're trying to figure out is, you know, what is that and how to slow that down? And we know how to slow it down. We know that ortho-K works, but why is that? And they did a study called the Candy Study, and it showed that the progression of nearsightedness in children that did ortho-K was a lot less. And what happens with children is the actual size or the elongation of the eye, the vertex distance of the eye, the actual length of the eyeball itself gets longer and longer and longer as they grow each year, kind of like their shoe size gets bigger and bigger every year. And with ortho-K, you put a contact lens on the eye, you reshape that cornea so that the child is no longer nearsighted, so light is focusing on the retina where it should be. But what we found from that is that it prevents that elongation of the eye as the eye gets worse and worse and longer every year. And so their nearsightedness gets slowed down. I have children that have done ortho-K or GVSS for their whole developing life. My daughter's included in that. Now she's in her 5th year, and the progression is not, nearsightedness in these children is not there when they're doing ortho-K. So I'm excited personally as a mother because my child has not gotten worse and worse every year. I'm really excited to be the eye doctor of so many hundreds of kids that I've seen the same results that they found in this study that they published called the Candy Study. So we kind of made a fun way of it in the office here to talk about why candy was good for your children. But it was just a way that we wanted our patients to know that there is something you can do for your child instead of just simply sit back and watch their eye get worse and worse every year.